Hey, hello, beautiful mamas, and all of our listeners. We are so excited to have you with the Balance Mama Project Radio today. We are having a follow-up discussion today to discuss infertility because our session last time went just stunningly with Katerina Jones. We are so excited to have you registered.
I'm so excited to be here. Thank you.
Yes, yes. We are looking forward to finishing our conversation because we dove
Mhm.
into some really important topics. So, for our listeners out there, I'm Dr. Val, Dr. Saya is with us as well, and we're going to dive in today to finish our conversation about infertility. There's so much information here, and you're a wealth of knowledge, so we're grateful to have you. Last time we broke down the biopsychosocial model and
Mhm.
talked about some physical and mental and social factors that might affect health as it relates to fertility. But could you
Mhm.
explain a little bit more and just give an overview here of what are some external factors that can
Mhm.
affect fertility? What are maybe some modifiable factors that can affect fertility?
Yeah, absolutely. And thank you again for having me on. Super excited to be here. So I think it's important to know like some of the external factors that can affect fertility are definitely like things in our environment. So that's like a super big topic that I think has been coming up a lot just in healthcare in general, but certainly as it relates to fertility. So for example, environmental toxicants. So basically that is anything that is in the environment that is like relatively out of our control, that is put into either our food, our air, our water, the personal care products that we use, like things like that, are what can affect fertility. So for the first time, we recently discovered last year, I think in like February of 2025 or so, that microplastics were present for the first time in ovarian follicular fluid and semen, with some studies that were showing that 100% of the semen samples had microplastics in them. So that's
Wow.
a very significant finding. Yes. Um,
100% of the semen samples had
one,
microplastics in them.
100% had microplastics. Yes, that's correct. Um, and so also exposure to pesticides, endocrine disrupting chemicals, so EDCs, or are things that are found in many of the personal care products that we use. So for example, phthalates, BPA, fragrance. That was a big one that personally hurt me because I'm a perfume girly. I love body care products that smell really good. But anything, and this is where sort of like health literacy really comes into play, of like being able to read labels and knowing like not just what you're eating, but also like what you're putting on your body. And I think we, as like, a lot of cisgender women, we like to use personal care products, and especially as Black women and Black birthing people, we love to smell good, you know?
Right?
Um,
Spray
and so
that.
totally. And like I'm a Bath and Body Works. I'm a millennial, grew up in the Bath and Body Works era where it's like the cucumber melon,
Sugars, yeah.
the sweet pea, the Japanese cherry blossom, like all of that,
Yeah.
right?
Mhm.
We're like slathering on our bodies just
Yeah.
constantly, we're spraying perfumes, we're doing all of the really good smelling stuff. And I think that that like is a form of self-care that I think a lot of us really kind of like lean into. But the problem with that is that a lot of those products do have chemicals in them that can disrupt our hormones. Like that has been proven. And so our skin is an organ, and what we put on our skin, it is getting absorbed into our body. And so what does that look like in terms of changes that you can make? You can start small. It doesn't mean like a complete overhaul of everything that you are using, but some examples of things that I did, for example, like I just switched slowly over to products that are non-fragranced, and you get used to it. So now that I've been using like non-fragrance products a lot, sometimes fragrances are too much for me now, and I'm like, oh, okay, it's almost like my nose has like reset. So you just kind of get used to it, and I'm like, oh, now I just like the smell of things naturally, like the natural smell of things. um or even just kind of like, you don't have to, I still wear perfume, but I don't wear perfume every single day, you know what I mean? And like just little changes like that. So environmental toxicants, sometimes it's out of our control in terms of like what's in the soil, what's in the air, but you know, you can limit your exposure. It's impossible to completely,
Yeah.
you know,
Get rid of.
just not consume these things at all, right? It's everywhere. Plastics are literally everywhere, but you can switch to glass Pyrex
Yeah. That's a
instead
couple.
of plastic.
Mhm.
When you get takeout, remove the food from the container that it's in. It's in a plastic container. Take it out and put it on a plate, because those plastics with the hot food is like seeping into your food. Like those are things that I think people just don't understand. Microwaving your food in a plastic container, don't do that. Like take it out, put it into a glass, and then microwave it to, or something, or put it on a plate. Things like that are just like small changes that you can make that are easily in your control, that can have an effect on just the way that your body is using your hormones. And obviously, like your reproductive hormones have to do with that as well.
Mhm.
So those are some of the external factors I think that are like kind of out of our control, but you can make some changes to help you avoid these things as much as possible.
Yeah, yeah. That's very interesting too. So I think the through line that we want to draw for our listeners too is that all of these things that some of which we can change, some of which we cannot change. We maybe can't
Hmm.
change where what our food comes into
Hmm.
our homes in, like what containers, but we can change
Hmm.
what containers we put it into, or we might
Correct.
be able to change the contents of our perfume. But if we want to use it, maybe we use it sparingly, maybe we decrease,
Right.
like just small changes like that. Not to say someone has to go cold turkey, no
Right.
fragrance, nothing,
Right.
but just consider the things that we're putting, like you said, on our skin, which is an organ.
Hmm. Hmm. Hmm.
And so we talked about all of these things having an impact on our hormones. We know that
Hmm.
for a whole person as well. And so our nervous
Right.
system is also involved in fertility. Can you talk a little bit about what role the nervous system plays in our fertility?
Yeah, absolutely. The nervous system definitely plays a big role in our fertility because it regulates hormonal production. So balance in that hormonal production system is key. Activation of the parasympathetic nervous system, which is more the rest and digest, as opposed to the fight or flight, which is like the sympathetic nervous system, is better for ovulation, sperm production, libido, all of those things. Like you want to try to prioritize activation of that parasympathetic nervous system as much as possible, as opposed to the sympathetic, which is going to put you more in a state of like chronic stress. And we do know that chronic stress raises your cortisol levels, and cortisol is a stress hormone. That's what kind of gets you into that fight or flight. If that is chronically elevated, the chronic stress that accumulates in your body, that's signaling to your body that conception is not a priority right now. We
Right.
have to, we need to maintain safety as much as possible. When you're chronically stressed, like your body is going to go into like trying to shore up your reserves to make sure that you are able to survive, right? Just from a very like evolutionary standpoint, your body is not going to prioritize making a baby when
Yeah.
you are in a chronic state of stress.
Right.
Um, and so, I think this is such a important topic to bring up, but it's also very nuanced because we live in a very high stress society, right? And
Right.
so a lot of like patients and stuff that I've worked with in the past, clients, they're like, how can I avoid stress? Like it's just a part of living sort of in this society. And in our modern world, we are overly stimulated, we're constantly distracted, we have things vying for our attention all the time. We are working jobs that require so much like physical, mental energy, like all of these things. People are not sleeping, like we're not eating nutritious food. Like it's just so, it can feel really overwhelming to be like, how am I supposed to control this, right? But it's less about trying to be a zen all the time, and more so recognizing when you are in a state of stress, and then taking actions, like having certain tools in your toolkit to be able to employ when you are experiencing that stress, to get yourself back into a less stressed place.
Yes, exactly. So, and what I'm hearing from that too is like the goal is not necessarily take away all of your stress. You're going to be completely regulated, and that's going to
Right.
last you. But it's more so, what are my tools that I have available to me so that when I recognize that I am in this state or am
Hmm.
sliding into this state of hyper.
Hmm.
And for those who don't know, maybe that can be like you feel your heart starting to race. You recognize
Hmm.
is really shallow, right?
Exactly.
That you notice that you're on heightened alert and every kind of noise is alerting you,
Right.
kind of those kind of signs are cues that your body's telling you to, okay, be aware. I feel like I'm in danger. I feel like I'm threatened.
Totally.
And then you can use
Totally.
tools to kind of keep that at bay.
Totally.
Yeah.
Yeah, I think that, you're touching on the core of it is that we are so out of touch with what's happening in our bodies. And I think that anxiety and stress show up in our bodies a lot. It's just that people are not aware of it, or they kind of like don't think of, they're like, oh, I mean, yeah, like I sleep maybe 4 or 5 hours a night, but like doesn't everybody, and it's like,
Right.
not real. I mean, that's not sure. Everybody might, but like that doesn't make it healthy or normal or whatever, Or like, yeah, I mean, my period hasn't come in like months or whatever, but like, isn't that? I didn't really think that that was that big of a deal. So, well, I mean, sure, you could have an ovulatory disorder, but also like you could be chronically stressed and your body's like, we can't do this right now.
Right.
You know what I mean?
That's right.
Um,
Bring it on the
so
back.
just like totally like having body literacy, like there's health literacy, of reading the nutrition labels, getting informed, being able to have like the knowledge that you need to make these informed decisions, which is core to my work, like through Full Bloom, is giving people the tools, the information, the knowledge that they need to be able to make these informed decisions through my consultations, classes, etc. But then there's also just your own bodily wisdom and your own bodily literacy that I think like we have been just removed from, and by design, honestly,
Yeah.
because when we're in touch with what's happening inside, then we're giving less attention to what's happening outside, and so we're spending less money. We are, not we're not engaging on the platforms, we're not doing all of the things that the folks that the powers that be want us to be doing, right? So I think it's like a multi-fold sort of situation where we are um just becoming a lot more aware of what's happening inside of our bodies, and also coupling that with just getting informed about how can I really like make this work for myself, and what are the things that I can do to really try to achieve an optimal level of not just health but also like fertility and reproductive potential.
Yeah. A lot of what you're saying reminds me of something Dr. Saya says all the time, which is that it might be common, but it doesn't mean that it's normal. So,
Correct.
yeah,
Exactly.
be having all of these things going on. You can be
Mm-hmm.
asleep or missing periods or this, that, and the other. You might be talking to your friends and they're like, yeah,
Mm-hmm.
cool, of course. Meanwhile, not only is that maybe affecting your fertility, but also it is not normal, although common.
Right.
So it's
Right, exactly.
things that you have to kind of be aware of to say, oh, let me see how I can address this. Maybe,
Mm-hmm.
and when you were talking as well, I was thinking about the social determinants of health and how that plays a role into for
Mm-hmm.
fertility, but a lot of health disorders. And
Mm-hmm.
I think about the factors that are involved with social determinants of health. So, like your environment, your built environment, your education,
Mm-hmm.
your income,
Mm-hmm.
nutrition, activity level, all of these things, um, and really the way that our society is built right now, it's not set up for you to be in tune with your body enough to know what's going,
Right.
enough to be able to employ those tools and make change. So it's really important that you're saying like, hey, that's a real big key part here of specifically as we're talking to fertility right now, but it's a big part of knowing your body and being able to
Mm-hmm.
those tools and address. And so
For
speaking of that,
sure.
you're thinking about like information, education.
Mm-hmm.
And then also maybe there's some misinformation out there. So could you say a little bit,
Hmm.
what are maybe some lifestyle changes that have been recommended but maybe are debunked as a result of fertility?
Yeah, I think one of the biggest things that I'm personally sort of like getting a lot more into now is just like nutrition and like eating for fertility because I think that, there's a really amazing book. It's called Real Food for Fertility by Lily Nichols and Lisa Hendrickson Jack. And they both, one is a nutritionist and the other one is like a fertility awareness expert and educator. And they did a incredibly well researched they co-wrote an incredibly well researched book about eating for fertility, and I think that a lot of people have the misconception that eating for fertility is just like being as lean as possible or like eating as clean as possible, right? And so like, but eating for losing weight or eating for body recomposition, whether growing muscle or losing weight or whatever, is different from losing or for eating for fertility. Specifically, you need fat to be able to have a really fertile environment. You need to really prioritize like protein and fat, and I think we have been so conditioned that like, lean cuts of meat and eating super clean and like all of that. But the problem is that people are undernourishing themselves. And so your body cannot carry out the processes that are needed for conception if they are undernourished. Like your cells need protein, like protein synthesis, all of your amino acids. Like our body is honestly like kind of mostly protein. It's like water, and then protein, that's what is needed for the synthesis of all of these things and bodily processes that happen, right? So we need so much more protein than we're actually ingesting, and we also need a lot of fat. Like there's fat, there's lipids in the cells, the membranes, the estrogen and progesterone are steroid like hormones, and they require cholesterol in order to like actually they are made up of cholesterol, right? And so in order for their function to happen appropriately and for everything to be going normally, they need fat to be able to do that. The problem is that there has been for decades long this like, anti-fat and stuff like that, low fat. Everything is like low fat, as lean as possible, etc. But our ancestors didn't eat in a way that was like that, and their fertility rates in the past were way better and so much higher than they are right now. Our ancestors ate a lot of protein and fat that
Mhm.
came from natural sources, really good cuts of meat, animal products that were grass fed, that were, free of like all of these different things and toxins that we are ingesting. And there's a huge, huge, huge link between the food that we're eating and our ability and the infertility rates that are just continuing to rise. Like that's just it's just there. The research is there, so I think that we have to kind of restructure the way that we're thinking about nutrition. We have to nourish our bodies if we want to conceive and then also support a healthy pregnancy. And nourishing our bodies means eating foods that you may not have thought are fertility friendly in the past, So like full fat dairy products are actually really fertility healthy. They have to come from a good source, like we need really good quality dairy. Like it's not just any kind of dairy, and it can't have like a ton of sugar in it. But full fat cottage cheese, full fat yogurt, full fat milk, cream, like things like that are fertility friendly foods that people have cut out of their diet because we're so conditioned to think that low fat is better. So like that, for example, is a really big misconception, I think, just around food and eating and nutrition. You have to eat for fertility. You can't just eat, a regular standard. Our standard American diet is terrible for fertility, honestly. I mean, we eat so much processed food, we eat so much refined carbohydrates, we
Mhm.
eat so much sugar that is hidden in a lot of the things that we are consuming. And all of those things in excess cause high inflammation in the body, and our cells and our body is not able to carry out our hormones become out of balance. And
Mhm.
so that's definitely a modifiable factor. I mean, I would encourage everybody to read that book, and also just, think differently about the way that you are nourishing your body if your intention is to try to get pregnant.
Mm-hmm.
I
Mm-hmm.
love, not to take if Valerie, you were going to say
Mhm,
something. I love the reference for the book and the emphasis on healthy fats. And I think there's a lot of times when
mhm,
I'll even see patients come in and they're like, well, my pain would go away if I lost weight. And so I think people get fixated
mhm.
because so many times in healthcare, people are told,
Totally.
if you lose weight, you will not have issue A, B, or C. And
Right.
in some cases, is this true? Perhaps,
Mhm,
but in all
mhm,
cases, or for the frequency that it's used, it is not. It's
mhm,
not true
mhm,
for everything.
mhm.
And so I love that you're like, yes, there are healthy fats that can be incorporated into the diet. Please reference the
Absolutely.
book because there is so
Yes.
many things, or are so many things that I would imagine, if we focused on wellness care more than like sickness care or
Mhm,
medical
mhm.
intervention. There's a
Correct.
lot that can be done. I don't know if in the standard clinic, if you've noticed where people will emphasize nutrition or exercise, if there's something to be said for exercise, or if folks are told, hey, well, go try these things. Not that you're trying to use more time because it is a time sensitive
Right.
process, but I don't know if that's emphasized.
Yeah, no, I would love to see more of an emphasis on optimization of the body
Mhm.
before getting pregnant or trying to achieve pregnancy. And the thing about it is, even for people who will eventually have to undergo assisted reproductive technology, you're still creating a much better environment for the treatment to be successful. So it's
Mhm.
still relevant. Like, optimizing your fertility naturally is still very much relevant to whether you are seeking fertility treatment or not. If you're trying to get pregnant naturally, you need to optimize your body for conception. If you are going through fertility treatment, you need to optimize your body to make the treatment as successful as possible. And there just isn't enough of an emphasis on that. Like, sure, there's time that is going into play, but you're actually saving people time and money and energy if we do work collaboratively with a holistic view as opposed to just a reductionist, like, this is the problem, this is why you're having infertility. Like, it's more than that. It's more than just opening up your tubes. It's more than addressing, whatever the sperm quality or whatever. A lot of these things can also be addressed by changing our lifestyle and changing the foods that we eat. And so I wish that people who were going through fertility treatment just automatically came with a lot of these things, like a nutritionist, or
Yeah.
like these sort of like additional services that all kind of work together. But um, unfortunately, that's just not how the system is set up. And, there are some clinics actually that I've seen. I haven't worked in any, but there are some clinics that I've seen that offer nutritional like advice for fertility,
Yes.
specifically work with a nutritionist or have access to a nutritionist who can work with you. So that is super great. But it's not standard. Like, it's often just people are given the advice of like diet and exercise. And it's like, we're not teaching people how to eat. We're not teaching people what kinds of exercise. We're not teaching people how to read nutrition labels, how to look for hidden sugars.
Mm-hmm.
Folks just don't have that information, or it's not readily accessible.
Mm-hmm.
So, I do think like, and with the care, it's not just preconception. It's like through pregnant, you're setting yourself up to have a healthy pregnancy that you can, hopefully carry to term. And then also your postpartum health as well. When you're lactating, like, you need to nourish your body in the entire spectrum of your reproductive like journey from preconception all the way through to postpartum. There are specific nutrients
Mm-hmm.
that the body needs that unfortunately we are not currently getting in our American diet.
Mm-hmm. Mm-hmm. Not without some true intentionality, for sure.
Correct. Right. Exactly. Yep.
And
Yep.
I know we were just talking about some, I should say, holistic modifiable factors. Um,
Mm-hmm.
when I think of non-modifiable things, yes, age can play a role, but I'm curious,
Mm-hmm.
um, for folks, or if you've seen many folks where they have had a child and then now for the second or for the third, they're like, oh, this is a little bit more challenging. I'm like, yes, your age has changed because time continues on, but what other
Mm-hmm.
things might come up for folks?
Yeah, so secondary infertility is a big, big thing. That's what it's called when you have either conceived in the past and or if you have had a child or children in the past, and now you are running into issues with, your second or third or fourth or subsequent children, and it's just not working for you. And so it is extremely common. I would say I had told Dr. Val before we started that I'd say at least 40% of the patients that I see in clinic have secondary infertility. Like they already have a child and then they're coming back and they're running into issues. But actually, just a quick search, it's like more like 50 to 60% of infertility cases are like secondary infertility of people who already have children or who have already gotten pregnant in the past. And now, they're running into problems. So it's a big thing because, and it carries a lot of nuance with it too, because there's an emotional side of like, well, I already have a kid, or a children. I should be happy about this. Like there are people who don't even have children, or there are people who have experienced significant loss, or whatever the case may be. But then that's not really being true to your own desires and like what your heart desires. If you want to have more children, like you should be able to do that. If that's a dream of yours and you want to complete your family and build your family even further, you should be able to do that. And so secondary infertility is definitely something that isn't talked about as much, I would say, as primary infertility, but it is just as prevalent as primary infertility. And so I think one of the reasons you touched on was like age, right? So the more children you're having, the more time that's going by, folks are just older when they are having like subsequent children. So they're running more into that age related decline. Um, there's also, like I talked about, sort of environmental factors, accumulation of oxidative stress. Your body and your cells, as you get older, they're just like breaking down more. The tissue is unable to repair as efficiently as it was before. So your eggs and, the sperm and stuff like that are less resistant to that kind of stress, that environmental stress that can happen. So there's that. There's also just like when you have kids, you often put yourself last. I know I can speak from my own personal experience. You're not prioritizing your health as much. There are things that can pop up. Now you have new diagnoses. Maybe now you have a thyroid issue. Maybe now you have, some kind of other like metabolic concern or something like that that's impacting your ability to get pregnant, when in the past that wasn't really the case. You didn't have that diagnosis. You didn't have that problem. But now, as you are getting older, as your body is starting to age, there are other things that are coming up that are considerations that they may not have been in the past. And then just going back to the whole nutrition and lifestyle, you don't have time. When a lot of times when you have kids, you don't have time to work out the way that you used to. You don't have time to prioritize your nutrition. You're taking bites of chicken nuggets and, goldfish. And literally the other day I was just doing this. I was eating my son's snack. I'm like, I'm not even hungry. Why am I even like,
It's just here, right?
it's just here. Like that sort of mindless eating, often tends to happen. Next thing you know, you just like are putting on pounds. So there are so many different things that can go into why folks are experiencing secondary infertility, even though they may not have had trouble getting pregnant in the past, but their life is different. Their life is different. Their job is different. Their level of stress is different. They're now caring for children. There are so many different factors that go into it, but it is definitely something that is super, super common, super prevalent, and we have to continue talking about it because it is like, it's a little tricky. It's like, oh, I should be grateful, but also I want to continue to expand my family, and this is really challenging for me that I am now running into an issue that I really didn't have before.
Yeah, and as you're saying that too, it's like, when you have one kid, people are usually like, "Oh, when's the second one coming?" But then if you
Mm-hmm.
not a lot of people even maybe ask you when's the third or fourth. So then
Mm-hmm.
dealing with this, maybe it's something that you don't feel comfortable sharing with people, or you think people aren't going to necessarily understand your desire to have
Yeah,
more.
totally. People are gonna judge you. They're like, are you trying to have another
They're like,
one?
"Oh,
That is,
You
yep.
know?
yeah,
Right,
we've
right,
all been conditioned to have the two kids and the picket fence." So it's like
right.
that then people don't, and then I feel like there's a missed opportunity for conversation there. And
Mm-hmm.
it's so prevalent, 50 to 60% of the population might be dealing with this, and we have
Mm-hmm.
no idea. We might be looking at our neighbors, our friends, and be like, "You're good over there," and they might be like, "No, we're
Right,
actually worried about our fertility chances and things like that." So
right.
even if whether or not someone's going through primary infertility, secondary, how can friends and family show up? Like, what are some things
Hmm.
family can say? What are some things friends and family think they're harmless about and it's
Yeah.
harmful? What can
Yeah.
they say?
Yeah, this is such a interesting one, because I think that, there's a lot that goes into play here. There's society, there's culture, a lot of things that are like culturally, people just say things, family who are well-meaning, family and friends who are well-meaning, who kind of want to like, just give you maybe some unsolicited advice just from a place of, they don't mean to cause harm, but it can be a little insensitive, right? So things like just relax and it'll happen, you're too stressed out. Well, at least you can get pregnant. Like for people who have experienced loss or have had children in the past or whatever, it's like, oh, well, at least you know that, you can get pregnant. It's like, okay, yeah, but that doesn't like help.
It
Like you
doesn't.
already no, it doesn't. You already said, when are you gonna have another one, or when are you guys gonna have kids? Just like being super pushy about understanding people's reproductive timelines and stuff. Like it's just not your business. And if people do end up opening up and sharing maybe some of the struggles or the challenges that they're experiencing, the number one thing that I think knee jerk people want to do is to try to fix it or like give advice, right? But like oftentimes folks who are experiencing any kind of challenging situation in their life, it's like you have to first ask them like, do you want me to just listen, or would you like me to help you solve this problem or whatever, right? So that's like a good starting point. And even if you're not comfortable asking that, just saying like, that sounds like really hard. That what you're experiencing sounds really difficult, and I'm sorry that you're going through that. Offering like actual very specific things like, hey, I'm gonna go take a walk in the park. Would you like to come with me? Or something like that, or I'm gonna go check out this movie. Like, I think one of the biggest things that I hear people who are struggling with fertility also struggle with is just like folks tiptoeing around them in a
Mhm.
way that makes them feel even more isolated. So, for example, like if you know that a good friend of yours is struggling and like you yourself have gotten pregnant and like not wanting to tell them at all, but then them finding out via
Mhm.
social media or through someone else is incredibly hurtful. It's like we are still people too. Like, sure, I may be experiencing this infertility, but that doesn't mean that I don't get to be happy for my friend, and just doing it in a very sensitive way. I know that this is something that's really challenging for you. And so I was hesitant, being honest about your feelings. I
Mhm.
know I was hesitant to bring this up to you, but, I do want to share that, we are pregnant. And so I just really want to be mindful. I wanted to be mindful about the way that I told you this news. And so I'm really just hoping that you will have the same outcome soon, or whatever it is that your heart desires. Just being thoughtful about what you say, I think can really go a long way. And treating people the way that you would want to be treated if you were having a really challenging situation happen to you. What would you want? Just like thinking about that first. What would you want people to say to you if you're struggling at work, or if you just got laid off or something like that? Do you think it's particularly helpful for someone to say, well, you'll get a new job, you'll get a job soon, oh, don't worry about it, like you're gonna get a job soon.
Before, so you're gonna get another job. It's like what?
Yeah, yeah, exactly. It's like, yeah, but like my entire source of income is now gone. Like this is really hard. That kind of just being in sort of tune. And so I think that it's people just like maybe having a person or finding someone who you really feel like you can trust, who is really like, it couldn't be there for you. It could be a cousin, it could be a friend, it could be someone who is removed from you but can give you sort of an objective, like, okay, I just need this level of support. I think the ways that we can show up for people if we know that they are struggling with infertility, is to just be there for them, help to support them, do things with them, don't exclude them from certain things, still just show up and let them know that you love them, you're there for them. If there's anything that they are wanting or needing, if they need time, if they need space, if they need a nice hot meal, I think these are all things that you can do to just support someone who might be on this journey.
I love the emphasis. Even it sounds like validation and companionship and showing up like you would in
Exactly.
any other. Cause I was like, yeah, people want to feel validated, not dismissed, or like, oh yeah, it's common. And it's like, yes, I've been waiting a long time actually, and
Exactly,
so
exactly. Or have you tried this? Have you tried that? Like, do you, like, maybe you should just like do XYZ. Have you tried this like tea or whatever?
or like I've tried it
Oftentimes,
all.
like, exactly, like
Or I
a
want
lot
to
of,
try it.
oftentimes, if folks who are experiencing infertility have legitimately been doing all of the things,
Yeah.
and so, just being mindful of that, I think is really important.
Yeah, I think about like even as a healthcare provider in our realm of expertise, sometimes I have to remind myself, if I'm being honest, to take off my healthcare provider hat
Hmm.
to my friends. And my friends know I'll be like, if they're like, oh, I'm dizzy, or oh, I have a headache, or oh, I'm going through this, I'm like, oh, did you do this? And then I'm like, wait,
Yeah.
let me bring it back.
I know. It's hard. It's hard. It's hard. It's hard.
Myself. Yeah, as a healthcare provider, right? And like I do have evidence-based knowledge behind me. Let
Right.
alone all the TikToks and and the Instagram stories and this that and the other
Hmm.
about various little tips and tricks that people can do. Now the whole world is ingesting all of this
Right.
information, be it correct or incorrect, that then they're
Hmm.
like, well, let me send you this video and send you this.
Yeah.
Like, no, sometimes people don't.
Yeah.
Sometimes they just need a person, a friend. Yes, like Dr. Say was saying, to feel validated, to feel loved
Right.
and appreciated. So,
Exactly. Exactly. Yep. Yep. Exactly that. So,
well, tell us, is there anything else in the world of fertility that
yeah.
our listeners should know about and that we did?
Hmm. Um, I think it's just I think one of the underrated things that people don't really understand is that it can really take a long time and it can take a lot of mental and emotional and physical energy. It can quickly become very all consuming, of like trying to conceive or dealing with infertility. Oftentimes it has been likened to receiving a cancer diagnosis in terms of just like how impactful it is to your literal overall well-being from top to bottom, like people who are told like, yeah, you are infertile, or you are experiencing infertility. It can be that devastating of something to go through. And so I really think that we have to give a lot of grace to people who are experiencing this, to really think about the ways in which we can support them, to give information, to give access to services and treatment. This is a right that we all have to build our families and create the families that we want. And so I think just the biggest takeaway is, it can really be a lot. And I think folks need to just give themselves a ton of grace. And if you know people in your life who are going through it, to also give them a ton of grace, because it's really difficult. It can be really, really difficult to have this desire, this like really burning desire in your heart to like have a baby, and for it to just not be happening for you, is just something that a lot of us take for granted. And so yeah, I really just want to kind of like emphasize that you know it can be a really long journey and it can be really all encompassing, but there is hope at the end of the day, and there are so many different ways to be able to build the family that you want. It just may not look exactly the way that you thought it was going to look.
Yeah.
Yeah.
That's good. Thank you. Thank you so much. Thank you. This was incredible. We
Thank you.
are really grateful. You have so much knowledge and information. We will absolutely put all of your contact information in the caption of this episode. With that being said, we ask everyone to stay balanced, and we'll see you next time on Balanced Mama Project Radio.